Hi, mommies. This is Mommy Doc Sam, a pediatrician from Bacolod City. Thank you for watching our first episode, the Mother's Day special of Mommy Doc Sam Vlogs with Miss Isa Lipton. I hope that you were able to learn something from her and from me as well with our experiences as mothers. Today, my guest is a medical expert. He is a pediatric ophthalmologist. He graduated from University of Santo Tomas, trained in ophthalmology at the East Avenue Medical Center, and did his fellowship at University of California in San Diego, nonetheless. Ladies and gentlemen, the first pediatric ophthalmologist in Negros Occidental, Dr. Kim Evaristo.
Hi, Doc Kim. Good afternoon. I'm Sam. Subong lang
Afternoon, Doc.
meet, no? Kaya, first time.
Thank you, Mando, for the invitation, Doc.
Gani, Doc. A little background lang, way labot sa kin-introduce na naka-early.
I finished my fellowship 2018. So, nag-start ko mag-practice around late 2018. Siguro mga October, ga-cover ko na-inline yung mga ophtha clinic sa mga established ophthas na. And eventually, I started my own practice sa South Bacolod General Hospital around, I think it was January of 2019. And then I recently transferred to Metro Bacolod Hospital and Medical Center beginning April this year.
So, masugod ta sa pinakagamay, no? Siyempre, we cannot discount the fact that there have been a lot of preterm births during the pandemic. So, how many, or can you give us a percentage of how much premature babies have been referred to you for the past year with retinopathy of prematurity?
Yeah, so that's an interesting question, Doctor, because before the pandemic, I would see at least 4 or 5 babies just for a screening procedure. So what we're talking about here is the problems of the eye when the baby is born prematurely. Ang aton subong screening criteria is any baby born around 32 weeks or less and less than 1,500 grams would be referred to an ophthalmologist, no? Because may ara posibilidad nga maguba ang mata because hindi pa fully developed ang mata. And before the pandemic, I would see babies, they were pediatricians or neonatologists would refer siguro mga 4 or 5 a week. And sometimes, most of the time, I would see these babies neonatal ICU. And during the pandemic, I would still continue to do this, but less, no, because I guess mas budlay maka-admit and generally mas dutay ang taong gagwa, no. I've been noticing that there are a lot of very preterm or very early gid nag-deliver because there were a lot of complications, no, kay patients tend not to go for their prenatal checkups. That's why damo complications can arise, mga hypertensives, diabetics, and that's why they deliver early. Retinopathy of prematurity exists or gakatabo ni siya because we found nga babies who are born very, very preterm or usually sa Philippines aton criteria is 32 weeks or siguro mga 8 months, no. Anyone born around that time or less, iya being a weight gamay-gamay pagid usually yung less than 1,500 grams or 1.5 kilos, gina-refer na siya, no? Ginalantaw na mo ng mata. And depende na sa status man sang baby, if the baby has a lot of infection during the stay sa ICU or gin-transfusion, gin-operahan for whatever reason. And the number one risk factor usually is if there's a lot of supplemental oxygen. So kung
Yes.
gin
Dugay.
ventilator
Oo,
or if
dugay
there's
naka.
intensive dugay, nakadugay, naka-base bisan nasal cannula, 100% oxygen. Usually this is the risk factor gid nga ga-cause ang problema sa mata, no. Pero sometimes kung damo gid masakit ang baby, typically they develop the disease around the 37-week mark, no. So mga lapit na mag full term tani ang baby, dra na do medyo flare up ang disease, and usually that's the time that we intervene, no. The protocol is kapag in bata na ang baby, example, let's say 30-week-old baby, the protocol for the Philippines is usually after 3 weeks, dra pa lang ta masugod screening, no. You give time for the eye to develop danay.
Okay.
And then we start screening. Screening usually involves putting eye drops sa mata para mag-dilate ang mata natin, ma-open ang pupil or ang ninyo sa mata. And then we have an instrument that allows us to take a look inside the eye para ma-examine namon. And if we do see the disease, may ala kami criteria ginamit pa para mag-start kami treatment. If may disease and hindi pa gid necessary ang treatment, we would just follow up closely.
I heard that you have a machine that or you're the only one here in Negros who has it. Can you tell us more about that?
Yeah, so there are I guess you're talking about for the treatment now of patients who developed retinopathy or prematurity. This would be, I guess, the laser that we use for treatment of eye diseases. There are many kinds of lasers in ophthalmology, pero the specific ones for retinal disease or ROP or retinopathy prematurity, we make use of a laser that essentially shoots the retina of the eye to treat the premature retina. No?
I see.
We were just able to acquire the machine early this year. So my wife, Dr. Kuni Evaristo, is a retina specialist, and she uses it mainly for diabetic patients, no, kung mga diabetic retinopathy. But we have a capability to use this on and deliver. We have a delivery system for the babies. Usually when we resort to a laser treatment for babies, this means that it came to a point ng there's a 50% chance nga mabulag ang baby. That's why we need to perform the laser treatment. No? The most common, ganito makita nyo may muta, may either if it's purulent or may muta, agad nga yellow, typically that means may infection. The recommended management usually is to do a swab, no, do i-culture mo, i-gram stain and culture. Pa lang conjunctival swab, no. So pwede gid, but most of the time correspond man sila sa do empiric treatment usually for the usual medication I see being prescribed is erythromycin ointment, which has very good coverage man of the usual bacteria. There are two kinds of conjunctivitis or pink eye. No? So if you have a patient or a baby nga gapula ang mata, gahubag, the son gamuta, ga-tearing, no, ginakalot niya, it's possible nga may conjunctivitis or sore eyes. So we need to distinguish between bacterial or
Viral.
viral conjunctivitis, or even allergic conjunctivitis, no, which is still possible. So
Mhm.
typically for babies, kids, bacterial ginang ilang sore eyes. So
Mhm.
if they do present to the clinic, usually muta gina siya, gahubag,
Mhm.
sometimes may mga low-grade fever. So it's possible nga bacterial, and usually they require good antibiotics.
What's your stand on breast milk as a cure for conjunctivitis?
Yeah, so if we go back to the causative agents for conjunctivitis, so if you have a viral infection, usually it will just go away whether you treat or not. So it's possible that kung may viral conjunctivitis in a patient and we put breast milk, it's possible that you may observe a improvement, no, but it's probably not because of the
Natabuan
breast
lang.
milk, it's because tabuan lang.
How long should you wait? Kasi ako, I'm really very conservative when it comes to antibiotics. So if I really feel it's a viral conjunctivitis, then I just let it subside. But there are times na more than 7 days ara gyapon. So would you recommend to start oral antibiotics?
For conjunctivitis, I don't really prescribe oral antibiotics.
Mhm.
Typically, it very responsive man to topical.
Mhm.
I would start a systemic or oral antibiotic na kapag may signs na nga medyo gaapektuhan na ang other parts of the eye. No? Usually, di kung may lid,
Oh.
gahubag na ang
Mhm.
eyelid, no?
Mhm.
Gadako na, no? And may signs na nga kaapektuhan na ang pinaka ang surrounding tissue sang mata. The Krigler massage is usually the management na ginausap natin para sa nasolacrimal duct obstruction, or the drainage of our tears from the eyes going to sa nose, no, di ba ma-feel natin ng luha natin, kakasabura natin sa it drips from our eyes to the back of the nose, to the back of the throat, no, kay may connection na siya. So the part diri sa aton nga sa face nga halin diri sa mata, you can actually, it travels over here, no, underneath the skin, a tube during our development sa womb. Eventually, when it develops further, open na siya. No? So sometimes, ang ato na nga statistics is around, I think it's 5% of all babies will have some sort of obstruction, either waay nag-open or nag-cannulate ang valve sa ina nga tube, or um, may mga higko, no, nga nagsupon dara. So
I see.
usually what happens with these babies is that 90% of these babies na may obstruction will just spontaneously open within the first year. Ginatest ko na, Doc, by squeezing diri nga area, ga-reflux na siya, so gabalik ang whatever
Oh.
nagsupon dira. And if it's purulent or grabe ginamuta, pwede ta ka prescribe some antibiotic na drop sa mata to address that infection. There's a procedure eventually, Doc, no, beyond 1 year old. However, before pa matabo na, tsakto na we recommend the massage, Krigler massage ang tawag mo. So usually, ang muna siya na medyo may halindri sa in between the eyes, or bisan diri gani sa babaw, ma-apply ta gentle pressure and press down hasta diri sa base ang nose, no. So ang gina-recommend ko is siguro ako ya 10 passes, no, 1 2 pwede man 5, and do this about 4 times a day. If you can do it more than that, you're welcome to do it. So if it persists after 1 year, gasigi gyapon ng tearing, then we could do a procedure that gina-trace mo ang drainage, and then ginaubrahan mo siya bag-o nga path, no. Ang amon nga consensus statement sa among society, the Pediatric Society, Philippine Society of Pediatric Ophthalmologists and Strabismologists, is that there is really evidence nga too much screen time can be detrimental sa mata sang bata, no? So
True.
mayara ta nakita sa Southeast Asia, no, before COVID, that there is a epidemic of nearsightedness, meaning there are a lot of kids and young adults nag-antipara na. Regardless, we would still recommend nga tani hindi lang bilog nga adlaw nakababad, no? If pwede educational lang, then it's fine. Kapin pasubong nga ti school is only through these gadgets. Pero kung puro games lang, basi pwede naton hagan-haganon lang kay may possibility gid nga mataas ang grado. So number one, there's really no radiation pag nga gagwa man sa mga devices nato na, no? So computer screens or flat screen TVs, they don't really emit any radiation. Siguro sang daan pa nga time when it was the vacuum tube nga TV ng mga dagko pa ba. Those things emit X-rays, but very, very minute quantities man. Too small to cause any problems, no? But syempre some stores would take advantage of this, and for them to
Yes.
sell, it's an unnecessary expense. So gina-discourage ko mga amo na.
Paano naton mapakampante or mapakalma ang mga mommies na hindi ma-paranoid na kung gapula ang mata ng mga kabataan nila or sila mismo na hindi man magpakulba na conjunctivitis due to COVID ayon.
It's more common to manifest or gagwa siya usually sa mga bata, no? So pediatric patients. And sometimes it might be the only manifestation. Usually it's accompanied by other respiratory symptoms, either may sore throat, may ubo. So that mas masuspect nga may COVID, although hindi tigid totally ma-rule out ang COVID sa sore eyes, no? So it's hard because it will be still the same recommendation, no? Try to avoid contact. Permi dapat tinlo ang kamot, and that's usually the main way you contract sore eyes is by touching something natandugan man sang someone nga may sore eyes. So if you develop sore eyes at this time, I mean, it's still reasonable to suspect na basi COVID na, no?
So anyway, Doctor, thank you very much again. And I hope to meet Doctora also soon. Maybe we can also discuss something else with her. We're happy that you're here.
Thank you again,
Congratulations on your new clinic. And always stay safe, Doctor.
Thank you, Doc.
God bless.
Salamat,
Okay.
Doc. Likewise.
Bye.
Thank you, man, Doc. Thank you. Bye-bye.
Bye.
Thank you again, Doc Kim, for your time and expertise. Alam niyo mga mommies, ako, ang natutunan ko is that the eye is very sensitive, very delicate. Hindi mo siya pwedeng i-take for granted. So, ako bilang pediatrician, na-realize ko din yung importance niya. Lalo na sa mga bata, dahil hindi sila marunong magreklamo, yung mga babies, or yung mga toddlers natin, or kids, minsan tinatago nila. So, we have to be very vigilant when it comes to our eye and our children's eyes. Alam niyo, ang naisip ko, there's this quote that I came across, and it says, in the blink of an eye, everything can change. So forgive often, love with all your heart, because you never know when you might have a chance again, especially in this pandemic. So I hope you love your kids, love your family, spend time with them, and take care of yourself. Till the next episode, my mommies.